As a pediatrician, I know how important it is to leave no one behind, to ensure that all children have access to medicines and formulations. The science is there. All we need to do is to bring that science together and use it in order to develop these life-saving medicines for children of all ages, everywhere, no matter where they live.
When children take drugs, they need to be palatable, easy to swallow. But what is most important is that they need to be adapted to their metabolic development. This is crucial.
Antimicrobial resistance is silently killing hundreds of thousands of infants every year across multiple diseases. And we have to build an antibiotic arsenal for them, especially our newborns who deserve their chance to live.
Each year, about 400,000 children and adolescents are diagnosed with cancer. The lack of access to effective cancer treatments results in a profound survival inequity between children living in low and middle income countries and those in high income countries. All children deserve access to cancer treatments. Children deserve our collective action.
The last decade has seen great acceleration in the drug pipeline for tuberculosis, but testing new TB therapeutics in and for children is still lagging way behind. And this is preventing much needed access in the field. It is important to regain the lost ground and to prevent the unacceptably long delays to improve access to better medicines for both the prevention and the treatment of tuberculosis in children across all ages.
In just 2 years, therapeutics for COVID-19 have been brought to market, helping adults to avoid hospitalization and death. Yet we have zero evidence that those same therapeutics can be used to help children who may need them.
A new era of antiretroviral treatment for HIV to be delivered in long-acting formulations might be around the corner. So now is the time to ensure children don't fall behind, and they can also access these innovations at the same time as adults.
Almost every minute of every day, a child dies from malaria, and therefore they need to be at the forefront of our research and development efforts. At MMV, we've shown this is possible, that we can prioritize the research and development of pediatric medicines to ensure that they get rapid access to the fruits of innovation.
The elimination of hepatitis C is now within our grasp, with highly effective cures for this terrible pandemic. And yet, despite these advances, children are threatened to be left behind due to a lack of development of pediatric formulations to enable their access to these life-saving treatments. Let's end hepatitis C once and for all.
Neglected tropical diseases affect the poorest of the poor, and children are left even further behind. We have to act through strong partnerships outside of market-driven drug development to reach them.
An availability of child-friendly formulations for TB can no longer be the excuse for not treating children affected by tuberculosis. Unfortunately, the biggest challenge and bottleneck we have is to ensure access to diagnosis for all children with TB and drug-resistant TB. And this is why we need financial resources, we need a lot of attention and awareness, and we need political commitment.
The development and transition to better pediatric formulations is going to help to dramatically reduce the nearly 100,000 HIV-related pediatric deaths. Only when we develop drugs with children's real needs in mind, and when we support country actions on uptake and rollout, that's when we succeed. And we can succeed by joining forces, all of us national, global health actors joining forces.
We have seen how working together can achieve rapid access to medicines, and we all have a role to play. Together we can rethink, innovate, find ways to better and accelerate quality treatments. And this goes from early drug discovery efforts all the way to approvals and procurement. And we can do it without compromising quality.
Children are our future. They must enjoy their full right to health and effective treatment, allowing them to grow and develop to their full potential.
No one actor can do this alone. In the field of pediatric medicine and public health, we know this all too well. We need all of GAP-F's partners to help leave no infant or child behind. GAP-F has the unique role of bringing together donors, product developers, industry, civil society, and all health policy makers with one united vision.
We're together, stronger.